At CNIB, a woman wearing sunglasses walks down the hallway with her guide dog by her side.
My name is Victoria Nolan. I'm a special education teacher. I was a Team Canada athlete for 6 years in the sport of rowing, and most importantly, I'm a mom.
My name is Andrea Chetas, and I'm Tiago's mom.
My name is Tiago.
My name is Molly Burke. I am 21 years old, and when I was 4 years old, I was diagnosed with a rare genetic eye disease.
When Tiago was 6 months old, he was at a doctor's appointment routine checkup, and they noticed that he had an eye movement called nystagmus. He had rotary nystagmus, and the doctor was concerned and actually sent me to Sick Kids.
I was born with an eye disease called retinitis pigmentosa, but you lose your sight slowly with this eye disease, and so I didn't realize that it was happening until I was 18 years old.
So over the course of about 6 to 8 months of my grade 8 year, I went from having pretty decent sight, being able to read large print still, to being basically completely blind. I really struggled with depression. It became very difficult for me because I was a 14-year-old girl who couldn't go shopping with her friends and pick out a cute outfit like they could. I couldn't do things like that independently anymore, and that really became difficult for me.
I would ask the doctors throughout the process, what am I going to do? Like, how am I going to teach him to read? Is he going to have to read in Braille? Where do I go?
One of the hardest times in my life was after I had my children. I really felt lost and unsupported in terms of my vision loss. I reached out to a lot of different agencies and people, and just trying to get help navigating this world that seemed to be, I seemed to be a pioneer in it.
I came to the CNIB, and that was a journey in and of itself, but I remember the first day at the CNIB.
When you get in a car crash and you need help and support getting healthy again, it's like right there, everybody's surrounding you and supporting you to build you back up. But that doesn't happen when you go blind.
For me, the ideal system would be one in which it's not up to me and my family to champion my cause, it's the system championing my cause. And I felt like there's a lot of support for elderly people with vision loss, a lot of support for kids with vision loss, but not so much for parents living with vision loss.
My wish for the healthcare system would be that they would be more connected, more plugged in, more aware of the necessities of families and children and young people and all people that have vision loss, so that that's just one less thing we have to worry about. It's just one less thing that in that moment, horrible moment of diagnosis, you go, oh, this is so bad. Oh, but wait, there's something I can do here. Here you go. You know, like, we've got something for you. There's a next step.
www.cnib.ca. Generously supported by Bayer Health, partners in care, championing the patient's right to seamless care.